Today I'm going to discuss about stable angina. Stable means why it is stable angina because it's we call it stable because it does not occur in the rest. It's occur in physiological and psychological stress only. Angina means pain. So it's chest pain. Basic it means. So the concept of stable angina is here. The occultation in the coronary arteries is not complete occultation. Atherosclerosis. It's a symptom appear if is it more than 70% only. If is it less than 70%, the patient is asymptomatic. It's the high yield point is here. It is a reversible injury. Basically, cell does not death. The the pain usually appear less than 20 minutes, and it radiation left arm or jaw. And another symptom is diaphoresis. It means excess sweating and shortness of breath. In the EKG, we can find ST depression. Why ST depression? If we consider our myocardial layer, the most outer layer is epicardium. Myocardium is middle layer. Most inner part is endocardium. So when the coronary artery supply the blood, it first supply epicardium, then myocardium, then endocardium. So endocardium is affect more. Like that's why it's called subendocarditis. So usually the pain disappear during rest. Why? Because during rest, oxygen demand is less. Therefore, pain disappear during rest. Second is nitroglycerin. Nitroglycerin is vasodilator in artery and vein. So, vasodilator which leads low amount of blood to return to the heart. Therefore, what happens? Preload, decrease preload, and the heart work will be reduced.